to another version of Bob's vlog. Today I'm in beautiful and sunny Shanklin. Main news this week is the announcement of the NHS Acute Services Review for the Isle of Wight. I want to start by saying I welcome the report and I thank Maggie and Steve very much for it. It's an important piece of work and I'm grateful at the amount of time that they've put into it. We need to be able to offer islanders the very best quality healthcare and the very best quality treatment, and I'm hoping this report will make that happen. Overall, I want as much health treatment as possible to stay on the island, and I want as fewer patient visits to the mainland as possible. I want to reassure islanders that this report is going to result in much better healthcare for the island. And I want you to reassure you about some of the scare stories and scaremongering that other political parties are doing, which I frankly think is a disgrace. I want to thank the island's NHS doctors, nurses and staff for the life-saving and life-enhancing work that they do, and this report is designed to help them do that better. I accept the need to transfer a small number of medical activities to the mainland, but in all the realistic options, and there are 5 options, in all the realistic options, which are 2, 3 and 4, the overwhelming majority of healthcare is going to stay on the island. Under option 4, which is a preferred option, about 9 out of 10 health procedures are going to stay on the island, and there will be a mild reduction in the number of visits to the mainland. I personally want us to be a little bit more ambitious, and I would prefer us, if possible, looking at option 3, which will keep 9.5 out of 10 appointments on the island and means several thousand fewer trips for patients as well. I also, as I say, want us to be ambitious, and I want to see the island as a centre of excellence for niche services such as dementia care. My priorities are for patients to have the best possible treatment and the best possible health experience. I want to try to return some of those services to the island. I want to use new technology and new practices such as telemedicine wherever possible to limit the amount of trips to the mainland and ensure higher quality of care. And I want, most importantly, we, the Trust on the Island, needs to work collaboratively and strongly with NHS trusts on the mainland to share expertise as much as possible, because one of the problems on the island has been that we've had jobs in the NHS which we've been unable to fill. So that's the reality. Please don't listen to the other bits, which frankly are rubbish. And I view this report as potentially a very good thing for the island and a good thing for the NHS on the island, and as a way of preserving and enhancing national and indeed international standards of healthcare for islanders and for the Isle of Wight. Thank you so much indeed, and I hope you have a happy weekend. Thanks.